Hi, welcome to the next peoplehub videocast. So this is a series of short videocasts to explore some of the issues that people are facing during the Covid-19 crisis, and this week to highlight Carers Week. We're hearing from people with lived experience of personalised care about how their lives have been affected, how they're finding ways to cope, and any tips that they might have that might be useful for other people in this situation. My name's Robin Chappell, and I'm one of the directors of peoplehub. This week I'm joined by Chitra to talk about her role as a carer and how coronavirus has affected her and her family. So thank you for joining me, Chitra and Avi. Do you want to introduce yourself and say a bit more about who you are and what being a carer means to you?
Thanks, Robin. Hello, my name is Chitra Acharya. I'm a computer scientist and I work for the NHS. My 10-year-old son, Avi, he is severely disabled and he has complex needs and he requires a lot of additional support on a daily basis. I'm his carer. Avi was born in good health but later developed a host of complex medical needs. He was in hospital for the first 16 months of his life and he had to undergo surgery many times. Important milestones in Avi's life, like his first birthday, his first Christmas, was spent in hospital. He still needs long stays in hospital as well as frequent medical appointments at clinics and GP surgeries and a host of different medications every day. I found it hard juggling the daily routine to care for Avi, but I also wanted to remain positive and make a difference in other people's lives. Over the last few years, I have undertaken a lot of voluntary roles in health and care and worked hard to influence the way care is provided for other people. This week is Carers Week, and it is an annual campaign to raise awareness of caring, highlight the challenges that carers like me face, and recognize the contribution they make to families and communities throughout the UK. And thanks, Robin, for giving me this opportunity to talk about my role as a carer and how coronavirus has affected me and my family.
No, thank you for giving up your time to talk to us. It's a really important week to raise awareness of carers and to hear your experience as well. So how has personalised care helped you in your caring role, and what difference has it made for you and for Avi?
Avi has a personal budget from Nottingham City Council. It offers more choice of services and providers than we were previously used to, and flexibility on how to use the support to meet his needs. In short, it offers control over his care and support services. And Avi is getting good quality support because of his personal budget, which allows him to enjoy himself whilst getting the best possible care and support that he needs. As a result, his confidence has also blossomed. The budget has particularly helped Avi to access many activities in the community, including weekly swimming lessons, frame football, after school club, and various activities and events during the school holidays.
Brilliant.
In this video, you can see Avi walking for the first time at his after school club, which was funded by Avi's personal budget.
That's brilliant.
That's he giving me a kiss. It also means that whilst Avi is having lots of fun, I have had the opportunity to have a bit of a life myself. I completed my PhD. I now work full time and I volunteer at various organizations, and I've been able to become involved in co-production as a peer leader or as a patient leader.
Fantastic. So how's the pandemic affected you all, and what you're doing to get by?
Okay, so Avi is not attending school and respite is closed. My husband is shielding. Myself and my husband are both working from home full time during the coronavirus pandemic. We are both working longer hours and caring for Avi. So it's been a bit difficult for us. We started self-isolating many days before the lockdown. We order groceries and medicines online and get them delivered home. We go to a back garden for fresh air and exercise. Avi enjoys playing in a tree house. It has a slide and a swing. Avi's face-to-face appointments are changed to telephonic appointments now. Avi's school, respite, and professionals from health and care are calling us every week to check in on Avi and us.
That's brilliant. It's really good that they're able to do it over the phone as well, and keep that remote contact with you all. So do you have any tips or suggestions that might be useful for other people who might be in a similar situation?
Yeah, 10 years ago, we were worse off. I was pursuing my PhD in Wales when Avi was born. He was in hospital for the first 16 months of his life. He had many surgeries and he was put on palliative care.
Mm-hmm.
I was with Avi in hospital 24/7. My husband, he worked in England and visited us over the weekends and holidays.
Yeah.
I'm counting my blessings during the coronavirus pandemic. We are now together as a family. We are all in good health. We cook and eat what we want. We go to a garden for fresh air and exercise, and we sleep in our own bed.
Yeah.
And technology is definitely helping us keep in touch with the outside world. We have regular audio, video calls with family and friends. We have a routine, and that helps. We try to eat healthy food as much as possible, and we avoid junk. Avi, he enjoys playing in a garden. He has a special walking frame to play frame football, and he loves his therapy tricycle. I exercise in our garden, and I also attend online dance lessons. I'm an NHS volunteer responder, and I'm on duty weekday evenings, weekends, and holidays. Helping others makes me happy. And also during the coronavirus pandemic, along with my caring role for my son and my full-time job with the NHS, I'm continuing to represent carers and as an expert in personalized care. I'm proud to be helping to shape services for people on a local and national level and feel that I'm really making a difference and contributing a lot of expertise as someone who accesses health and care services a lot.
Mm-hmm.
So these are the things that we have found are helping us to cope with life through the coronavirus pandemic, keeping positive, counting our blessings, and helping others where we can.
Brilliant. It's really good to hear that you're all coping okay and getting on with life while shielding and looking after Avi and carrying on with work as well. So thank you ever so much for giving up your time to talk to me. And thank you for listening. And we hope that you found this interesting. We'd love to hear your feedback and comments. If there's any particular subjects that you'd like us to cover, or if you want to get involved and share your experiences, then we'd love to hear from you. You can get in touch with us by commenting on Facebook or Twitter, or you can email me directly at robin@peoplehub.org.uk. So thank you for listening, and thank you again, Chitra, and thank you, Avi. Take good care, and we'll catch up with you soon. Thanks, Avi.
Thank you.
Thanks, Chitra.
Oh, thank you.